Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're discussing sarcopenia. You probably have never heard that word. It's an age-related condition that leads to loss of muscle strength, loss of muscle mass, and loss of muscle performance. It's a major factor in frailty, falls, disability, and loss of independence in older adults. But new insights into genetics, developmental origins, and even regenerative therapies are helping us better understand and treat this condition. To guide us through this topic, I'm joined by Dr. Bryn Henderson, a board-certified physician and expert in regenerative medicine. Dr. Henderson, thank you for being here.
Well, thank you, and it's a privilege.
So, let's start with the word itself, sarcopenia. It sounds kind of scary.
Sarcopenia is a progressive and generalized skeletal muscle disorder. Sarco meaning muscle and penia meaning lack thereof. So it's characterized by a decline in strength, quality, and quantity of muscle is also present. It's not simply part of aging, it's a medical condition. Left unchecked, sarcopenia increases the risk of falls, fractures, and hospitalizations. Rarely also impacts mortality. People die.
All right, what genetics play a role here with sarcopenia?
It absolutely has a heritable estimate that range from 30 to 35% for muscle strength and 50 to 80% for lean mass. Variance in gene susceptibility is widespread. Genome-wide studies also identify new variants involved in metabolism and energy regulation. Beyond the DNA and epigenetic changes, there's altering expression of sarcopenia-related genes.
What about developmental or embryologic factors in early life? What events influence sarcopenia risk?
Oh, that's an excellent question. And low birth weight, early growth patterns all determine peak muscle mass, which predicts not only muscle mass, but muscle strength in decades later. Maternal undernutrition also contribute and can reduce the number of muscle fibers because of the capillary density in the offspring. So that means less and fewer blood vessels, predisposing them to sarcopenia later in life when they need the blood. Satellite cells repair and regenerate muscle are also shown to be reduced with some functions in aging, but their biological traces lead right back to the fetal development.
How does traditional Chinese medicine look at sarcopenia or muscle wasting?
That's a good question. TCM looks at it as a flaccidity syndrome. It's sort of like Raggedy Ann or Raggedy Andy. You're just flaccid. Your muscles don't have strength. They don't have tone. There's a decline in the qi, both the spleen, qi, kidney essence, and liver blood. TCM looks at this in terms of a balance disruption, and the treatments include herbal formulas, which have shown benefits in muscle strength, and practices like Tai Chi. Tai Chi not only helps balance muscles, but it also enhances bones. So many women use Tai Chi to eliminate osteopenia as well as sarcopenia. It's great for balance and endurance. And TCM emphasizes the constitution-based care, complementing both the nutrition and exercise.
What other conditions can look like sarcopenia or muscle wasting?
Great question. The differential here is essential. The neuromuscular disorders like ALS, amyotrophic lateral sclerosis, or inclusion body myositis, which is inflammation of some of the muscles, can mimic sarcopenia, but often show asymmetry or biopsy changes. Endocrine disorders are common. Cushing's, diabetes, all can cause secondary muscle weakness. Medication-related myopathies also overlap, and the nutritional deficits of these result in cachexia, and they must be considered.
Can you tell us about the regenerative therapies that are now being studied for sarcopenia or muscle weakness?
Sure. And you're correct, there are. The regenerative cell therapies show promise because they make new cells. so they can restore muscle mass, reduce inflammation, and they show us that if you combine a healthy cell and exercise, you can produce the best outcomes. On the peptide side, IGF-1 performs enhanced protein synthesis, mitochondrial function, and of course BPC-157 shows tissue repair properties in animals and humans. These approaches, they highlight the potential of regenerative medicine.
All right, beyond the experimental therapies, what lifestyle changes can a patient adopt?
Lifestyle is, in fact, the cornerstone. Resistant training, which 2-3 times a week, is the single most effective intervention. Adequate protein, about 1.2 and as much as 1.5 grams per kilogram per day, distributed across all the meals. So it's critical to get good protein. That's the message. The leucine-rich foods, like dairy and soy, have vitamin D as well. Vitamin D correction is essential, as well as the omega-3s, which help, along with hydration and reducing sedentary behavior, all lend itself to cleaning things up, like sleeping more, drinking less, and just don't smoke at all.
All right, what does the prognosis look for patients that you've diagnosed with sarcopenia in your office?
Well, patients should be screened. In fact, we screen everybody as they come in the door with a way to determine their muscle strengths of both arms and legs, as well as their trunk. And then we work on, if it's identified, I probably see 1 or 2 new patients a day that have various degrees of sarcopenia. So the sooner you find it, the faster we can fix it. If they've had falls or hospitalizations, it's a big red flag because we're already late. The tools like gait speed and hand grip strength and the Sarco-F questionnaire, which is very readily available in our offices, are a simple, rapid screening tool developed to identify individuals at risk for sarcopenia. They're simple to use, and with early detection and consistent intervention, sarcopenia can be slowed, and in many cases, partially reversed.
Well, let's talk about your mnemonic for sarcopenia care.
It's the word muscle.
M stands for?
Monitor strength, grip test, gait speed.
U?
Utilize resistant training regularly.
S?
Support nutrition, protein, and vitamin D and omega-3s.
C?
Check for comorbidities, diabetes and hypothyroid.
L?
Lifestyle changes, hydration, avoid smoking and alcohol, and stay active with good sleep.
And the E?
E is evaluate for emerging therapies. The regenerative therapies are real exciting. Peptides and TCM, it's a good adjunct.
Well, thank you, Dr. Henderson, for talking to us about sarcopenia, a word that probably our audience has never heard before, a condition that affects millions, but can be managed and improved with the right approach. If you or someone you know is noticing a decline in strength or mobility, please don't wait. Give Dr. Henderson a call. Come on into his office and see the cutting edge things that he's doing to help independence and quality of life. So, thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.